Would you like to improve the daily productivity of your physicians, reduce hospital readmissions and uncompensated ER visits, as well as lower the cost of patient care? How about if you just made the lives of your patients a little easier? Well, you can with MeVisit, a simple smartphone app. MeVisit is a revolutionary way to deliver healthcare, an easy-to-use mobile application. Building on the foundation of the patient-centered medical home, MeVisit literally puts medical care in the hands of patients and their own doctors with a mobile electronic visit, a MeVisit. Each MeVisit is simple and quick for both the patient and the medical provider. Jill here went camping and developed a rash on her arm. Instead of clogging the system by going to the ER, she begins a MeVisit on her smartphone. After signing in through our HIPAA-secure login, she describes her condition. Our logic-based interrogation engine uses simple, to-the-point questions to obtain a thorough HPI. In fact, it can aid in the diagnosis of over 1,000 conditions. In addition, each patient is encouraged to add unstructured comments, those extra details that make each patient unique. And this is especially helpful for Jill, who includes a photo of the plant she encountered. After a quick check of the history, she submits the case to her own doctor. In less than 15 minutes, she's skipped the waiting room and gone straight to the head of the line, without ever having to leave her campsite. MeVisit is the world's first mobile-to-mobile telehealth solution, so Jill's doctor receives a simple notification on his device. Because MeVisit is asynchronous telehealth, Dr. Jones can address Jill's request when he can give her his full attention. When he has 5 minutes, he logs in and is presented with his active case queue. Dr. Jones reviews Jill's HPI, photos, and her personal health record. Based on the needs of the individual, the physician directs the case and has the option to contact the patient via secure video, secure text, telephone, or simply conduct care as a MeVisit. In Jill's case, Dr. Jones is confident of a diagnosis of poison ivy dermatitis and selects that from his editable library. Dr. Jones' library is customized to him and includes a thorough care plan and patient education. As you might expect, every encounter is easily tailored at the point of care, making each one unique. When Dr. Jones submits the case, copies are sent to Jill and his office to be installed in Jill's chart. MeVisit allowed Dr. Jones to provide professional care in less than 5 minutes. He also reduced his liability by providing more thorough information than he can give in his busy office, all from his mobile device. MeVisit was designed for efficiency and to keep a continuity of care between physicians and patients. It has been clinically proven in real-world conditions through a 30-month university-backed clinical study and accepted at multiple peer-reviewed forums and publications. Traditional synchronous televisits take 10 to 15 minutes of a physician's time, typically confined to office hours. MeVisit is a fully paid, fully documented visit that takes less than 5. Clinicians spend less time, fewer resources, and are fully compensated for their intellectual work. And because we keep care within the medical-home relationship, medical providers can address minor acute, some moderate, and stable chronic care requests. By engaging primary care physicians, MeVisit also translates to further savings. Because minor care can be shifted online, it's possible to reduce unreimbursed ED care. Also, home health care using MeVisit to document and coordinate with family physician can reduce hospital readmissions. Our study found that more efficient use of time was only one benefit. We found that by moving the 40% of encounters that don't require an in-office visit to a mobile asynchronous setting, which by the way is 40% of your patients that don't really want to be in your office away from home or work, MeVisit increased clinic productivity by 19% and lowered the per capita cost of care by 15%. That's over an extra hour per day to add value and provide better, more efficient care to patients that need hands-on diagnoses. And that's great news for healthcare systems struggling on a 1 or 2% margin. We understand the system from an inside perspective. MeVisit was created by experienced physicians trying to improve care for their patients. In a time when our culture has embraced mobility and e-commerce, MeVisit works with each participant to improve the health system that we all share. From patients to clinicians to insurers, everyone benefits. True mobility, true savings, revolutionary telehealth, all within 5 minutes.